for joining. We're going to go ahead and get started. We know everyone's time is valuable, and we did modify the time of this briefing slightly from last week based on some feedback that we received. So first of all, I want to thank you all so much for your feedback. We did get some really great feedback about the webinar and the briefings. We are going to make this as much as possible a weekly occurrence, so you can expect to hear from us. We want to keep the communication going with all of you and ensure that everyone is notified about all of the goings on with the ELT and our efforts through academics to our facilities team and everywhere in between. So again, just appreciate all of you joining us. And today's briefing is actually going to focus on a specific topic. We have chosen to kind of hone in on a topic weekly from now on, so you will get notice of what those will be in the communications that are sent prior to the briefings each week. So we do take requests if you have some ideas or information, and we're trying our best to really take a look at the questions that are coming in and sort of the hot topics and build our topic around some of the most frequently asked questions that we're getting, and that's what we've done this week as well. So this week we'll be going over a number of items, and we do have a brief presentation that we'll share with you just to guide the conversation. I'm going to share that now. And actually, before I do that, let me introduce the team, because we do have a special guest this week, and I'll let Mrs. Buckley introduce herself. She is joining us today as a guest panelist because of the content that we'll be sharing today. So Mrs. Buckley, you may have to unmute yourself.
Hi, good afternoon, colleagues. Cynthia Buckley from the Office of Student and Employee Services. Looking forward to a discussion regarding COVID and leave availability. Thank you for having me on today.
Thank you, Ms. Buckley. And just as a reminder, the rest of us that you see on the screen, we represent the executive policy group of the emergency leadership team. So once again, you'll be hearing from us on a weekly basis to keep everyone informed of everything, all the efforts that are happening university-wide. So with that, I will share my screen and we will go through just kind of a way to guide the conversation. So Mrs. Buckley really teed it up for us. The items that we'll be discussing today, we are going to discuss the notification process for potential exposure of COVID-19. We want to make sure that everyone is very familiar with that so that we can ensure that that is being utilized. We'll also have Ms. Buckley share with us information related to accommodations for COVID-19, specifically for whether you've been exposed or if you need accommodations based on an underlying health condition. And she'll speak more to that when we get to her portion of the presentation. And finally, the legislation that is associated with the Families First Coronavirus Response Act, specifically around the leave that is available. First, we're going to discuss the notification process. We will, in doing so, define exposure and what that means according to CDC guidelines. We will outline the process for notifying the university if you believe you have been exposed to someone with a known case of COVID-19 or if you yourself are exhibiting symptoms. We will talk about contact tracing. And finally, we'll talk about university outreach and reporting before we move to Ms. Buckley. So with that, I'd like to introduce Dr. Ruth Jackson to share more on the notification process and defining exposure. Dr. Jackson? I think you're muted, Doc.
Thank you.
Dr. Jackson, I think you're muted.
Okay. How's that?
There you go.
I'll talk to you a little bit about, as Mrs. Powell mentioned, defining exposure. According to the CDC, the risk for transmission of COVID-19 is very low unless you're within close contact, which is defined as 6 feet within an individual for more than 15 minutes. The use of PPE, such as masks or face coverings, further decreases this risk. One of the things that we want to make sure you think about is the idea of primary exposure versus secondary exposure. Were you in close contact with an individual who has tested positive for COVID-19, or were you one or two people removed? For instance, someone you know was in close contact, or someone that you are in contact with was in contact with someone who tested positive for COVID-19. So in terms of our definition of exposure, we're thinking primarily about the primary exposure. If you believe that you have been in contact with someone who's tested positive for COVID-19 in primary contact, we're asking that you utilize the form that was created to notify the university. This form can be downloaded by using the QR code that you see in front of you. And this will direct you to the form that looks like this. So this is the one that we're asking you to fill out. And based on this form, you'll be provided with further instructions and follow-up for next steps. As a precaution, as always, we want you to monitor your health and report any symptoms that you have using this form. This form will be, as well as the QR code, will be uploaded to our COVID-19 resource page for easy access.
Thank you, Dr. Jackson. And now we'll move to Dean Busby, and he'll talk to us about our efforts in contact tracing. Dean Busby.
Good afternoon, everybody. And so our efforts around contact tracing is driven almost primarily by the notification form that Dr. Jackson just guided us and walked us through. And so the information that is provided within that form will dictate what the response will be and the level of direction that the employee or the student will receive from the emergency leadership team. There will be a follow-up and screening that will be conducted by a medical professional that will support and be able to reach out and conduct daily screenings with our employees and or our students on a daily basis. And when we say daily basis, we're saying even through the weekend as well, through that quarantine period of 14 days. And so that individual will be able to follow up with the employee or with the student to monitor the symptoms, to ensure that they are being nursed back to health. Of course, that follow-up will be done via telehealth, so either via Zoom or via phone call by telephone. And so that will be how we look at operating the contact tracing. And of course, again, included in all of that will be the self-isolation and monitoring, all conducted by the medical professional.
All right, thank you, Dean Busby. And now we're going to move into the university outreach and reporting, and Dean Snavely will share more on that process. Dean Snavely.
Thank you, Mrs. Powell, and wanted to follow up on what Dean Busby just outlined. So, as you can imagine, there's all kinds of questions around notification, right? People are asking us, the emergency leadership team, they hear rumors, they hear people talk about potential cases. And so notification is really critical, not only what information comes to us from you, our students, employees, and stakeholders, but also it's really critical about the information that we relay out to everyone in our community. And so, like I said, it's really twofold. And what I want to outline is the kinds of communication that we're going to be making as an emergency leadership team out to our community around COVID-19. So there's a list of appropriate disclosures of people within our campus community that every time The notification process occurs, and then we, using that medical professional, perform the contact tracing. Following those two events is when many of our required and appropriate disclosures will happen. So the first in that group is us as the executive policy group of the ELT. Will understand all of the various aspects of that notification form and the contact tracing. Second, we'll be notifying and reaching out to local and regional healthcare authorities. Third, we will utilize the contact tracing form in consultation with the medical professional, the results from the contact tracing interview, to notify any persons who have had who have come out on that form as having had contact or interaction with the person who's been exposed, with the person who's tested positive, or the person who's experiencing COVID-19 symptoms. A fourth group of persons that could be notified, depending on the circumstance, are our Sodexo dining and facilities teams. So in the event that the person who has displayed symptoms, tested positive, experienced exposure is a student and quarantine or isolation is needed, we'll be working with the Sodexo dining teams and the housing teams to ensure that meals are delivered to the quarantine spaces. In one of our first meetings with this group, we talked about those quarantine spaces, and so that will be an important part of this disclosure, is letting the dining and any facilities folks who could get pulled into a maintenance request. So we'll be consistent with privacy regulations and laws, notifying those teams. The next is our Sodexo cleaning teams. So both in cases where they might be needed to clean a space immediately or after certain time periods, those Sodexo cleaning teams will be notified appropriately so that those cleaning processes can begin consistent with both our protocols and Sodexo's protocols. That time period, just for your knowledge, is now 24 hours. So after, if someone had tested positive for COVID-19 or been exposed to someone who's tested positive, the Sodexo teams would wait 24 hours before they go into a space, and that's consistent with their guidance from the CDC. And we'll share more on that. That's in our plan. And cleaning will probably likely be a topic for its very own one of these webinars in the near future, and we can go into more detail. I already mentioned, but the housing and residential teams are another category where disclosure might be appropriate and reasonable. They are often in and out of those spaces, the residential spaces. So they would make that list as well. And then the last area would be student and employee services. So whether it's related to an accommodation, leave, perhaps it's through SES that gets to help a student make accommodations for an instructor. That's why student and employee services is on that notification list. So that's our portion of the updates around a potential COVID-19 case, a potential exposure, or someone displaying symptoms. And those are the protocols that we will follow with every case based on, one, the notification form that Dr. Jackson outlined, and two, the contact tracing interview that Dean Busby outlined that will take place between these persons and a medical professional. Lastly, from a notification standpoint, these weekly meetings on Mondays, now at 3 o'clock, will also be the source by which we will keep you updated, our community generally, about potential cases, active cases on Langston campuses and sites. So we have our 3 campuses, this Langston campus, Tulsa, Oklahoma City, and the Ardmore site. So we'll be releasing on a weekly basis 3 different types of information. First, the number of active cases on those 3 campuses and site. Second, the percentage of active cases on the Langston campus. And that percentage is important because we're the only campus or site of those 4 that has housing. And it will relate to the third area, which is a percentage of current persons in quarantine or isolation. Those are critical markers for us as we decide on the operational posture of the university. And we want you to have an understanding of, but not inappropriately private information about these persons. So we'll be releasing that information on a weekly basis. The percentages will come after next week due to add drop period. So once we understand the full number of persons living on the Langston campus and the full number of persons enrolled on our other sites, we'll be providing those percentages on a weekly basis. So I can report the first category today. So the EPG has been navigating 3 different scenarios or incidents so far. So we've had 3 positive cases on Langston campuses or sites. Only one of those cases is now active. All the other 2 are no longer active cases. In all 3 cases, contact tracing was performed, and the persons in close contact or who might have been in close contact with those 3 persons were identified or were notified and reached out to for further medical inquiry or meetings with their own medical providers. So today, or as of today, there's only 1 active case on a Langston campus or site. And again, we'll be using this meeting every week to update you on that and let you know both the number of active cases and the percentages that I listed earlier.
Okay, thank you, Dean Snavely. And now we're actually going to move into Mrs. Buckley's portion. So perfect segue, we're going to talk about what happens if you should need an accommodation. And these really come up if you have an underlying medical condition that might require you to have an accommodation. Mrs. Buckley is the one that can help you with that. So Ms. Buckley, you can move forward with your portion of the presentation.
Excellent. Thank you so much. And so colleagues, especially for professors specifically, but if you have any students who are requesting COVID-19 accommodations, they need to contact me and I will ask them for documentation. So the students have to have an underlying medical condition to receive COVID-19 accommodations. I've started to get some requests for students who thought that they could just, that they had a choice and just contacting me without an underlying medical condition. That is not correct. Students do have to have an underlying medical condition identified and documented in writing by their physician to be considered for a COVID-19 accommodation. So if students do have an underlying medical condition, they are required to provide me with the written documentation on the letterhead of their physician that tells me the underlying medical condition and that the physician is requesting that the student not be on campus this semester and be able to take their classes off campus, and has to have the signature, name and credentials of the physician. Likewise, for the faculty and staff, the process is very similar. The process for faculty is outlined in the ELT documentation, in the plan, the return to work plan, but it's specifically spelled out in Appendix C. And if anybody needs me to send that to you, I certainly can. I'll send you a link to the official information. But for staff members, you have to, again, have an underlying medical condition documented in writing by your physician and provide that information to me on the letterhead of the physician that tells me your underlying medical condition, that they are requesting that you not be on campus working for the semester, and with the name, signature, and credentials of the physician. For faculty members, an added component to that is we will also need your course information we would need you to provide us with the name of your courses and all the classes that you're teaching this semester. So feel free to contact me and I'll provide you with all the information regarding how to request an accommodation for COVID-19. Now, once I receive the information, I make sure that it meets all the criteria. Then I'm going to contact your immediate supervisor and we're going to talk through the accommodations and the request. So essentially, I have a matrix that I work through, and I make sure that we have the medical documentation provided on the letterhead, that this request is for yourself or an immediate family member, because that does count as well. And if it's an immediate family member, we have to have the documentation, the same medical documentation about the family member. We don't need robust medical information, but just that same information on the letterhead, but about the immediate family member. Then we're going to check to make sure that the underlying medical condition falls under the CDC guidelines under the vulnerable category. For faculty, we're going to make sure that we have your course information. And one of the main components is we're going to look to see if your job can be conducted via telework. And so those are the things that I'm going to outline and we're going to discuss with your immediate supervisor. And then if all of these categories check off and they're approved, then you will receive an email from me in writing that your request for an accommodation has been approved. It would have had my documentation would have had my signature and the signature of your immediate supervisor and or the dean or vice president. And so this information is private information. It's not going to be shared with a large group of individuals. It's a small group of 2 or 3 people who need to know this information. If your job cannot be performed via telework, then I'll talk to you about what that process would look like, because we'll work through that with your supervisors as well. So
I don't mean to interrupt, but I see that Dr. Johnson has raised her hand. If you'll hold on to your thought, Dr. Johnson, we will address the questions at the end. So just hold on to your questions and we'll have some time at the end once Ms. Buckley gets through the information.
Excellent, thank you so much. And now to the accountability side, the documentation will also talk about accountability. It's going to talk about that if your request is, for example, if it's a faculty member, if the faculty member has been approved to continue to telework this semester, it's going to talk about the expectations that you need to be available for meetings, for your class hours. You need to be available between your regular work hours. So it's going to talk about the expectations and the accountability, same for the staff members, because we must realize that and remember that telework is working. It's not a vacation opportunity and time to not be accountable. You have to be accountable. If there's questions regarding your accountability, the supervisor could certainly ask for a weekly productivity report or statement. And so it's important that you continue to be available, that you are responsive to emails, responsive to calls, typically within a 30-minute time frame. That documentation, the approval documentation, will also outline any type of expectations for continued successful working from home. All right, now we're going to talk about the Families First Coronavirus Act. So as you may know, Congress enacted this act as a result of the coronavirus. And with this act allows for paid leave for employees who are unable to work or so that they can telework due to various situations or circumstances surrounding COVID-19. So I'm going to share my share my screen. So that we can talk about the various leave categories. So it's important to know that with the COVID-19 and the legislation that there is leave time available, and the university does have the various leaves available to our employees as a result of the COVID-19. So hopefully everybody can see that screen. Okay, and so here we're looking at my leave balances so that we can have an example. So when you look at, so what I did was I went into Banner and then I went into self-service and then I went to the leave balances. And so right here you'll see where it says COVID others, dependent care, 480 hours. This is, there are 3 different COVID leave categories that you're going to see in Banner. This dependent care is for employees to take care of the needs of your dependent children or immediate family members. For example, we'll talk about school closings. And so we know that there are a number of school closings, or we know that there's a number of virtual classes that our students or our children are having to participate in. This leave is available. You can use this leave if, for example, if I needed to be with my son or daughter on a Thursday at home, I could identify maybe 2 hours that I'm going to help them log in and connect with their classes, but then I'm going to telework for the remaining 6 hours. I could use that 2 hours with my dependent care time. So one way is to use it intermittently, use it as you need to, but you can also telework, and you can also, of course, in this scenario, I'll be in the office Monday, Tuesday, Wednesday, and Friday, but I just would telework / use my dependent care to assist my son or daughter with their virtual learning. So dependent care is available. It's up to 480 hours. So if you have any specific questions regarding that dependent care, let me know. And all of this is important that we're going to coordinate this with the supervisors. HR is not going to make the decision, but we're going to all make the decision collectively and give you your best guidance and recommendations and suggestions on how to maintain your workload and maintain and see about the family members and your priorities at home. So the dependent care is available 480 hours under the Families First Coronavirus Act. And then also we have the COVID employee sick. So if you have COVID, you can use 80 hours, 2 weeks for your COVID leave, or if you need to go have testing done. So that 80 hours is available as well. So we have our 2 primary COVID categories, the employee sick, which is 80 hours, 2 weeks. Then we have the dependent care, the 480 hours. And then the third is the sick leave emergency. That is the last COVID category. That category is if you have exhausted all of your leave in all categories, but you do have COVID or some type of COVID related emergencies. That is what that leave is for. And so if you have any questions about that, let us know as well. So those are your COVID leave categories. We talked about the process for submitting your leaves. And if you have any questions, I can certainly take those.
Okay, thank you, Mrs. Buckley. If you do have questions, please, if you feel comfortable doing so, you may add them to the chat, or I believe the Q&A feature is also active for this webinar, so you're welcome to do either.
Ms. Powell, I think they can also just directly message just the panelists if they don't want it to be in the full, for all attendees to see. And we can anonymize the question, so to speak, when we say it back to the group.
I do see a question. Does leave need to be approved with HR for COVID leave prior to the team member taking leave? No, you don't have to get us to approve it prior to you taking it. But what's going to happen is every month we receive, when we run payroll, we receive a COVID leave report. So we do receive a report of those individuals who have requested their COVID-19 leave. We're going to, if you've contacted us before, you said, hey, I have COVID or a family member, then we know that you're going to be using your COVID leave. And that's certainly fine because it's there for your needs. But if you have used that leave and we didn't really know that you were going to use it or that you had a need, we're going to reach out to you, because sometimes individuals mark that COVID leave on accident. And so for reporting purposes, we will reach out to you and say, hey, just want to make sure, did you actually have a COVID need, or did you do that inadvertently? And if you did it on accident, then we'll work with you to put it in the right category. But if you did need to use that, then that's absolutely fine. But you don't need our approval to do it, but it's just kind of good to know. If you'll let us know, hey, I'm dealing with this situation related to COVID, we'll know, so that when we see that report, we're like, hey, they told us about it. and everything is good to go. But always reach out to me or anyone from my team, because we're here to work with you on your COVID needs. Another question is taking leave for dependents, does that mean we are taking leave or are off during that day, or taking it to allow telework? It's really going to be on a case-by-case basis, depending on what your needs are. So when an employee asked me just today about COVID leave, because their son or daughter was doing the virtual classes, our question is going to be, what are your needs? Do you need just a couple of hours in that day, or do you need a whole day? What amount of time do you need to handle your family responsibilities, as well as balancing your work responsibilities? So it's going to vary on a case-by-case basis. So you can always talk to us, and we can to help guide, and then also be a mediator with your supervisor if you have any questions. Another question is, if my son's school closes for a period of time due to a COVID exposure, typically 2 weeks, will I be able to take this COVID leave in order to be home with him and telework for that period of time? Yes, that is what that leave is for. And so we would certainly recommend intermittent COVID leave, that you assist your son or daughter, getting them together with their virtual learning, and then also spend some of your time with the COVID teleworking, the COVID leave, and then other part teleworking throughout the day if possible. That's going to be our best recommendation, is to try to find a balance within that. It may be some circumstances where you have to take the whole day. That leave is certainly available to you, but trying to kind of use it intermittent is going to be our best recommendation.
I would just add, I think, the executive policy group and AVP Buckley and her team, we've spent a great amount of time really trying to ensure that all of our policies are designed around encouraging you to report, right? So that, whether that's a situation at home or you're experiencing symptoms or exposure, all of those things, all the policies and the guidance is set up so that, hopefully it makes it as easy as possible, right? We don't want anyone coming to work if they're feeling sick. We want everyone feeling like we're able to make these accommodations where possible, so that we can create an environment that accomplishes our mission and provides for the safety and well-being of our employees, our students, and all of our stakeholders.
Excellent. Another question is, for which type of COVID leave does there need to be a plan in place with HR regarding for a team member taking COVID leave? But that really does not need to be any plans in place with HR. Your plan is really going to be, and what you're going to do is really going to be between you and your supervisor. If that means a rotating shift, if that means intermittent COVID leave. But if you have any questions and want us to be part of the conversation, we certainly can do that. And then also, which COVID leave category should I use, my COVID dependent or my personal COVID leave for myself? We can help you through all those things. Another question is, as it pertains to children, with your example, if your children are doing virtual learning and you're trying to find balance, does that qualify? And does that qualify in terms of the COVID dependent leave? If that's the question, yes, it does, because we know a lot of schools are doing virtual learning, and our faculty and staff have been doing a great job on finding that balance between assisting their son and daughter with their virtual learning and your work responsibilities as well. And so, yes, continue to try to find that balance. And if you have any questions with that pertaining to your leave or just a conversation with your supervisor, let me know. We'll certainly work with you. Because ultimately, HR is here to try to help you find that balance. And so we want to be a resource to you during this time. That's all the questions that I see.
And if you have questions about other things, not just the student employee service portion or the act or the leave, we're open to taking questions, not only just about what we've discussed today, but really anything COVID-19 or emergency operations planning related.
So just to know, the human resources mantra that we stole from Dr. Emily Harris is safety and service. And so that's going to be our goal, is to balance safety and service for all faculty, staff, and students. So reach out to us if you have any questions, and we'll be glad to help. All right, I guess I'll turn it back over.
Okay, well, thank you, Ms. Buckley. And just as a reminder, I put it in the chat, but if you have questions or if there are topics that you're interested in us covering, we kind of have a schedule planned out of some topics that we'll be covering in the next few weeks, but we are open to your recommendations as well. Again, we're trying to take a look at the frequently asked questions that we receive and build our topic schedule from those questions to ensure that the topics are timely and that they're meeting the needs of the community. So please don't hesitate to reach out to us at luelt@langston.edu. We're happy to answer any questions that you have there and also take any recommendations that you might have. We're welcome to those as well. And just to wrap up, we're gonna let Dean Busby just share some final words on resilience.
So thanks again, all of you for tuning in today. Thanks to, I say special guest, but she's been here with us since the beginning, AVP Buckley as well. And so to our faculty, staff, and students, thank you for taking the time to be with us this afternoon. It is our hope that the information that we have given you today is something that you find to be of great substance, of quality, and it's beneficial. And so from the initial notification form that Dr. Jackson spoke about to the contract tracing form, which is an additional form, depending on what information was given in that notification form that we have, that will be completed by a medical professional, to all the assistance and provisions that have been put in place by the institution through our Office of Student and Employee Services. It is our hope that you understand that your institution, Langston University, is working very hard to not only serve our students, but also to serve our faculty and staff as well. To our students that are here, it is our hope that you had a great first week of classes. We know that this week is the first week that you're transitioning in groups of 10 or less back to the classroom. And so we hope that that has been a seamless transition for you. And as we've stated for our incoming freshmen, and we've had the conversation with you and even our returning students, as well as faculty and staff, the community in Langston University is a resilient one. To our incoming freshmen, we know that many of you didn't even get to participate in a graduation to celebrate a huge accomplishment in your life, which was to graduate from high school. And even though, you know, we had some students that were to graduate from Langston and didn't have the opportunity to participate in that graduation here from Langston University, but you are resilient. You're here, you're working, you're grinding. And so we are here for you. We're here to support you. To our faculty and staff, you are the backbone of the institution. We couldn't do this without you. And so as has been stated today, and as AVP Buckley has stated, if there's any questions or concerns that you have relative to support, please reach out to the Office of Student and Employee Services. And of course, as Mrs. Powell so eloquently stated as well, any questions that you have as well, feel free to reach out to the luelt@langston.edu. Again, luelt@langston.edu email address, and we will work with you, and we're working for you to continue to get through this, because we will get through this together. Thank you so much.
All right. Well, thank you all for joining us. Chief Holland, I'd be remiss if I didn't let our team members speak. Any final words from you, sir?
Yes, just to echo what Dean Busby had said, I just want to tell everyone to stay encouraged and take care of yourself during this pandemic. You all have to remember that you must do your part, as my fellow panelists has discussed. We will get through this, and know that limiting visitors here on campus is to keep our community safe. The safety of our campus is everyone's responsibility, so therefore we need your help. And as a reminder, make sure to obtain your university parking decal. The enforcement deadline begins this week, actually Friday. This is how you will be able to access campus, so stay safe. Best of luck to everyone this semester, and I will turn it back over to Mrs. Powell.
Thank you, Chief. And AD Rogers, thanks for that softball on the parking decals. You can pay for those at the cashier window in Student Employee Services. I elected to do the payroll deduct, which is the easiest way, but I know that they accept other forms of payment as well. So make sure to take care of that. I got mine this morning. So thank you, Chief, for all that you and your team are doing to help keep us safe. And until next week, we will send out some information on our next webinar. But again, just thank you all for joining us today and stay safe.